The University of Kansas Health System and University of Kansas Hospital are facing a lawsuit tonight.
The federal lawsuit claims the hospital denied a woman an emergency abortion the night of the historic Kansas vote preserving abortion rights because of the heated political environment. Fox 4's Dave DeMarco live outside the KU hospital tonight with details and the hospital's response. Dave?
And the director of media relations says the hospital cannot comment on this lawsuit because they haven't received it yet. But the hospital was made aware of these alleged violations last year by the Secretary of the U.S. Department of Health and Human Services.
August 2nd, 2022, the same night Kansas voters upheld the right to an abortion under the Kansas Constitution, Melissa Farmer traveled to the hospital from Missouri when her water broke at just 18 weeks, making her pregnancy not viable.
When she got there, she assumed, because this is what the law requires, that she would get the basic health care she needed, emergency health care she needed, but instead, 2 hours later, they discharged her without having provided any treatment whatsoever.
A year later, the Secretary of Health and Human Services sent a letter to hospitals across the nation saying it had launched an investigation into what happened at the University of Kansas Hospital and reminding all hospitals that it's a healthcare provider's professional and legal duty to offer necessary stabilizing medical treatment to a patient who represents to a covered emergency department.
And that night, they just decided to send pregnant patients home at risk of possibly dying. And that is unconscionable, and that is it's sex discrimination, and it is against the law.
In the year since, Farmer filed a complaint with the Human Rights Commission. But after more than 300 days with no response, they've now filed a lawsuit, one of the first filed under the Federal Emergency Medical Treatment and Labor Act since the overturning of Roe v. Wade. It says the doctor advised inducing labor, but then was overridden because, quote, it would be too risky in the heated political environment.
Instead, they sent her home at risk of becoming septic, of hemorrhaging, of losing her fertility, or even dying.
She eventually had to travel to Illinois for care. The lawsuit says Farmer suffered physical, psychological, and financial harm.
What she says over and over is that I just don't want what happened to me to happen to anybody else.
And while the hospital was not prepared to comment on this lawsuit, they did have a little bit more to say when this case first went public last year, saying in part that the care provided was, quote, in accordance with hospital policy. We're going to go ahead and attach that previous statement, John, up with our new coverage of this case tonight.